Hi, my name is Dr. Miriam Pinellas, and I'm an acupuncturist and herbalist. I'm here today to demonstrate the use of Moxibustion for turning a baby in a breech presentation or posterior position. Moxibustion is an ancient Chinese therapy that involves the use of an herb called moxa or mugwort over specific acupuncture points. This procedure should be done for 10 days, 20 minutes per day on the pinky toe of the pregnant woman. If the baby turns before the 10 days are up, you should continue this procedure, and this will help keep the baby in the appropriate position. I'm going to demonstrate now how to use the moxa. This is the moxa stick. We're going to light the moxa stick and wave it over the pinky toe, the lateral side of the pinky toe of the pregnant woman, and we're going to do it on both feet. 10 minutes each foot. You can do Moxibustion sitting on a chair, or you can also be laying down. If you are going to lay down, please do lay on your left side. While you're doing this, please make sure to be next to a window. You can also do this outside. It's a very smoky, very odorous experience. So make sure there's good ventilation around. Okay. So we light the stick. It can take a couple minutes. If you don't have a lighter at home, you could also light a candle and just keep this over the flame for a couple minutes. Want it to get nice and hot and start to smoke. Okay, and you can test it on yourself. You bring it close to the skin, you never touch the skin. Just make sure you can feel that warmth. Okay? The pregnant woman should feel the warmth on her skin. It should not be burning, and it doesn't have to burn to be effective. She should just feel the warmth. You take the stick, you go to the lateral side of the pinky toe, the outside corner, here, and you do a slight pecking motion. Do you feel the warmth? Okay. Once you know that the woman feels the warmth, you just continue at this rate. There's really no wrong way to do this. Just make sure she feels the warmth. Okay, and you can do both toes at once if you want. 20 minutes. If it's starting to get too hot, you can pull back a little bit, give her a break for a minute, and continue. Please remember to ash periodically so that you don't burn or cause a mess. And continue. Okay. Another important thing to know when doing this is to make sure you extinguish your moxa stick well. Simply patting it down in an ashtray or on a plate will not be enough. I always recommend a few drops of water at the edge, or dipping it into some water. Don't fully immerse it. Just make sure it's out at the edge. The next day, when you're ready to reuse your moxa, simply cut off the charred edge and start again. Moxa has been shown in recent studies. There were systematic reviews in 2006 and 2012 that did show Moxibustion was more effective than postural positions for turning a breech baby. It was also shown to not have any significant differences in terms of safety. So the use of moxa is a safe procedure. Also women should know during moxa you will feel the baby be more active. Okay, not to be alarmed, this is normal and this is fine. Good luck, and thanks for watching.
My name is Pam, and I'm a patient of Miriam's. I had been seeing Miriam, and it came to my attention around 30 weeks that my baby was transverse, and I was concerned about the position. Miriam gave me moxa and instructed me how to use it, and at night my husband and I did the treatment, and within 3 days the baby had moved to head down, which I was extremely pleased about.